Ooh, let's see if this is working. There we go. Perfect. Today we are going live. Little funny start here. All right. So if you missed it Friday, this is going to be all about fertility and the pelvic floor. So let's see here. Let's see if I can get this right. Possibly. Here we go. Beautiful. We are streaming live on YouTube and live on Instagram. And today I thought we would talk about and recap the talk I had on last Friday. If you missed it, I didn't do it on our platform. We did it with Women for Nutrition or Nutrition for Women. And you can check that out on our Instagram. We have a shout out. But I thought it would be a really good opportunity for me to discuss why the pelvic floor and seeing pelvic expert PT should be one of your first stops in the thought of preconception. So when you think you want to get pregnant, why pelvic floor therapy should be kind of your number one, like, hey, let's check this out and see what's going on, or let's check this out to see where I'm at, to know what my baseline is before I actually even conceive. Now, that's excellent. Some people will also come to us because they've been trying to conceive for a long time and haven't had success, or have repeat miscarriages, or repeat DNCs often. So that's where that will happen sometimes after a miscarriage. And so we're going to just talk about all things infertility, struggling to conceive, and what you can do to make your body the best possible house in order to conceive. All right. So I'm excited to talk about this today. And I'm going to just introduce you to the pelvic floor and talk about why it's important to start addressing pelvic floor health before you even conceive. We're going in the afternoon today. Normally we are doing this in the morning, but I am here with my decaf coffee as I am still 6.5 months postpartum, almost 7 months. And man, we've been trying to do some sleep training, and that's worked some, but then there's just some nights where my baby's she just wants to party all night and feed all night. So here we are. And of course I want her to gain weight because she's been a little bit of a slow gainer. And so that fatigue definitely sets in, and it is currently 3:30 in the afternoon. And so here we are drinking decaf coffee. Awesome. Well, thank you so much for being with me. And if you are hoping to get pregnant in the next year or two, or have been trying to get pregnant, this is going to be a great episode for you. Now, in the United States, typically we say that if you are trying for more than 1 year to get pregnant or to conceive, then you have infertility, or you're struggling with infertility. In every other country, it is not until 2 years of actively trying to get pregnant that we diagnose that as quote unquote infertility. And so the US really jumps ahead, and we're impatient about a lot of things. And so that's one of them. It's like we're like, okay, you've been trying for a year, have infertility, let's get started with specialists. Most of the time when people think about seeking a reproductive specialist, they think about going to the doctor or seeing some reproductive medicine doctor who will either specialize in IUI, IVF, or run a whole lot of tests to find out like if there's anything mechanically wrong with you or your partner or the semen itself or your ovaries or your eggs, whatever that may be. And so one of the things that really gets missed and is a huge detriment, I think, to the fertility journey, because when you go through any of that fertility stuff, it can be really, really a stressful experience, and you don't want to be going down that path. Like typically you're mourning every time you get your period or suffer a loss, right? I mean, it's a big deal, and it definitely affects your psyche. And so if that's the first stop, it's immediately assuming that something is wrong with you. And now once you get to that point, a lot of times people are just like desperate, like they just want it so bad that they'll do anything. And so I want to make it clear that really taking a holistic approach and like addressing the physical body itself can have such massive effects on and improve fertility and set you up for conception. So let's talk about this. How does the body, or how does a pelvic expert PT even know, or what do they do that's going to help with the fertility process? Okay, perfect question. Great question. So I got asked this on the live I did, and I thought it was just beautiful. And she just asked such great questions, Sydney did. So the very first question that I answered was, well, pretty much if you think about the organs in your body, so we're talking about the colon pumps stool around and has to move in your body to pump that stool so you can have good bowel movements. Well, the ovaries have to move in your body, right, to pump the eggs every month down the fallopian tubes. And then the uterus has to contract every month to slough the lining, and that's called menstruation, right? So our organs have natural mobility. So we call that visceral motility. And you want to have good visceral motility. So our organs should be able to move in our body without actually independent of breathing. So yes, breathing, inhaling and exhaling is going to move and shift some of the organs. Like you can just physically tell that, right? And if you put your hands on your tummy and you take a deep breath, you're going to be able to tell that taking a nice deep breath is going to expand your belly and shrink your belly. And when you have that expansion and shrinking, organs are going to move and shift. Well, even without that breath, we need the organs moving in our body. Okay, so what stops organs from moving in our body? Well, scar tissue, number one. So the scar tissue from a C-section, scar tissue from an appendectomy. So when you have your appendix out, or any laparoscopic surgery can leave scar tissue. When we have scar tissue, our organs freeze and they don't like to move. And so we want to restore that mobility. Stress can also cause that tightening in the belly and prevent those organs from moving. And so what we can do with a pelvic expert PT is help get those organs moving again. When we do that, the organs can move beautifully and be free of any limitations, and that can help fertility. Okay, that can help those organs move, help the eggs come down the fallopian tubes and allow them for hopefully semination, right? So to meet the sperm, and then we'll hopefully get implantation after that. And so this is the process that needs to happen. We need to have organ motility. All right. So number one, a pelvic expert PT can help you with that organ motility, which can be great. They can also help break up adhesions. So adhesions have been shown to be a cause of mechanical infertility, or at least play into mechanical infertility. And so adhesions are any dense deposits of scar tissue or tissue that's not aligned in the normal fiber alignment that can cause tightness and really wreak havoc on the normal mobility of the system. And so we want to deal with those adhesions, and that's another thing that the pelvic PT can do for you, is to help break up that scar tissue and improve the motility that way. When we break up the scar tissue, we improve the tissue and we improve the blood flow. And therefore, then like our core as a whole we can usually get more coordinated because of that. Because if there's any scar tissue, let's say in a muscle, so let's say it was a C-section and we cut open our transverse abdominis muscle, which the fibers run like this or like this. And so if we cut in those fibers and we have scar tissue there, it can't contract and relax as well. And so when that's happening, it makes it more difficult to function appropriately. So that's important to think about. So dealing with the scar tissue is important. The next thing to think about is the actual pelvic floor itself. So if intercourse is uncomfortable at all, that can cause guarding and freezing, right? Like we don't want to be open for insemination. And so if intercourse is uncomfortable or you have any pain in your vulva, we tend to be more constricted. When we're constricted like that or contracted, we tend to have lower blood flow and decreased blood flow. And then things are more irritated and painful. Less lubrication can be common. And so it's important that we start working through that. And so a lot of times people, and I'm going to just come to another screen here because I had something pulled up I wanted to share. So from an article, Wern et al., and I can drop this in the show notes, but they state that manual soft tissue therapy facilitates fertility in women with a wide array of adhesion-related infertility and biomechanical reproductive organ dysfunction. So this is huge, and it could be a great starting block. Pelvic floor physical therapy can be a great starting block for your physical therapy journey. For your fertility journey. And so, to some of the other things that it does, that pelvic floor PT does, is it can restore visceral motility, like we said, bony alignment, soft tissue mobility. And this is all non-surgical and non-invasive. And so there's very few risks involved and no side effects or complications, truly. So it can be just it's a great adjunct to your medical infertility treatments. So like going to the reproductive doctors, getting IVF, and it has been shown with mechanical infertility to pelvic floor physical therapy has been shown to improve the outcomes of the infertility treatments like IUI and IVF. So that's really exciting stuff. And so that's what I wanted to share with you there. Some of the signs. So, I think ideally in a perfect world, right, everyone would have this pre-conception journey where they get to meet with a pelvic expert PT, find out where their organs are inside their body. Because a lot of people might have tightness within their pelvic floor, and they might have pain even before they have babies. They might have incontinence before they have babies. They might be dealing with hemorrhoids or constipation before they have babies. And they might also have pelvic organ prolapse. I did before I had babies. So, and that was just from my athletic background, lifting heavy weights and probably being hit a few too many times in hockey. And my bladder sits lower than it should. And so I knew that before I had kids, which then helped in the recovery process because I really knew what my baseline was and I knew if things were worse or not. And as long as I could, it helped in the recovery process. And I just think everyone really deserves that because when you know what's happening pre-pregnancy, you have a good baseline of what you can expect postpartum. And then not to mention the healthier the tissue is because you've worked on it pre-pregnancy, the less issues you're going to have during your pregnancy and postpartum. So these are just some benefits that all flow together, ebb and flow together, truly. And so that's more reason to seek out pelvic expert PT on your fertility journey. Really, a lot of what I shared last Friday was all about the function of the pelvic floor. So I'll go through that now and I'll talk about the function and then I'll talk about the dysfunction. So really you can self-assess if you're experiencing this now, that could be playing into your fertility journey and might be a reason why to at least think that you have some type of pelvic floor dysfunction. So I'm going to talk through that right now. So here's pelvic floor, all right? There are 3 layers of muscles of the pelvic floor. So we have our first layer, which is multiple muscles. We have a second layer, which is not shown here, and that is a fascial layer, but also has muscles in it as well, along with sphincters. And then we have our third layer, which is deep pelvic floor muscles, and then also has some hip muscles attached to it. Okay, so there's 3 holes that run through the pelvic floor. We have anus, we have vagina, and we have urethra. All right, so they have different functions, and there is a separate doctor for every hole. And so if you're having issues and you don't know where to go, that's not your fault. There's literally a doctor for every hole. And that's where maybe a pelvic expert PT can be a first great sounding board to figure out like, okay, what's going on here and where, if you need to see a doctor, where do we need to send you besides getting pelvic floor therapy? So let's talk here. Let's go to our urethra. Let's talk urethra. Okay, so everything bladder function and urination. So this is if you're peeing your pants or you leak when you sneeze or cough or run or jump or can't get through your exercise routine, you might have some issues within this part of the pelvic floor. All right. And all these muscles contribute to that function. So the ability to be continent. A healthy bladder can hold urine for about 3 to 4 hours. And then a healthy bladder should be able to delay the urge of urination for at least 15 minutes. So the minute you get an urge to pee, you should be able to be like, okay, no, I can hold it and not leak, and then go to the bathroom. But if you have urge incontinence, you might get an urge and then pee a little bit, or pee before you fully sit on the toilet seat because you just like couldn't hold it. Or you get home, you put the pee in the door, and you try to unlock the door, but then you can't. You pee a little bit just because you're like, I have to go so bad, that you didn't even have to go when you were driving home. But the minute you saw your front door, you were like, it triggered you, you had an urge, you got to go. Sometimes people get the same thing, this urge incontinence with running water, and that's common. So those are all signs that like, hey, my pelvic floor might not be functioning right. Let's check this out. Let's get this figured out first before, and maybe that will help us on our preconception or on our fertility journey. Okay, so that is just excellent to get figured out first. Second, now let's move to the next one. We'll talk vagina. All right, so the actual opening is the vagina, and that is for childbirth, right? Or for intercourse. And so the benefits of doing pelvic floor therapy prior to actually conceiving is monumental, and there's no research that says it because no one does it, but it is just incredible, especially when treating the pelvic floor throughout pregnancy. The amount of change that you can make to help prepare for childbirth and then make that childbirth experience that much easier and just be that much more prepared. And then what those someone who does pelvic floor therapy during pregnancy, that postpartum recovery is exponentially different than what we see when you haven't had this kind of treatment during pregnancy. So if you have it preconception, it's even better. You're going to have this starting block. You're going to have it before your hormones have really started to shift and change. And so it's just a great baseline. And then not to mention can also help you conceive. So let's talk. So when we're talking pain in this area, so if you have any painful intercourse at all, so that would be pain with penetration. You can also check out there's a whole episode on intimacy and sex problems or pain with intercourse that happens. So you can check out that episode as well. But if you are having any issues here, you would maybe have pain with insertion. So anything inserting into the vagina, or if you couldn't tolerate insertion. Some people come to us in their fertility journey because they truly can't even tolerate insertion. And so then they can't partake in that journey of intercourse in order to conceive. And so that is something that we would help with, and that can be amazing, the changes that you can make in a very short period of time. And so helping with pain with intercourse, and then anything with deeper thrusting. So maybe a position doesn't feel good or a different position doesn't feel good, then we can absolutely help with that and help those muscles. A lot of times it's due to tightness, but we can help those muscles relax and open. And so relaxing and opening is going to be also that much better, not only for intercourse, but in preparation for a baby to come through. And so that's where it's like everything is a double whammy. Like if you work on this stuff before you actually conceive, it's going to help you that much more in your fertility process. In your pregnancy process, in your fertility process and your pregnancy process in preparation for birth. And then also help that much more in the healing process after birth. So that's just good information to have. Now let's talk everything from the anus. So anus, if you have hemorrhoids, anal fissures, sometimes that can be from straining or carrying tension in the pelvic floor. The pelvic floor carries a ton of stress, and so it's important to address that. Okay. Now, what also can happen is constipation, IBS, any bowel disorders or irregularities. A healthy bowel is going to have a bowel movement every single day. And if you don't have that bowel movement every single day, let's look at that. Let's find out why. And constipation isn't technically diagnosed until not having a bowel movement for 4 days, but truly a healthy bowel is going to go every single day. And in the fertility journey, because we want really good organ motility, right? The organs moving in our body. We want the bowel to be producing a healthy, happy bowel movement every single day. And so when I'm doing this motion, I'm doing a peristalsis motion. So that's what your colon should be doing to pump the stool through. We want that stool, that poop, to be coming through easy. You want to be able to breathe that stool out and be able to get it through your body without having to strain and bear down. Because if you're straining and bearing down, that's going to be very stressful on your pelvic floor and can cause issues like pelvic organ prolapse and can cause issues like hemorrhoids and anal fissures. And so those are important things to just keep in mind. So if you are trying to get pregnant and I'm saying some of this stuff and you're like, yeah, I've always had constipation, or I only poop once a week, or maybe I have painful intercourse. These are things and important things to keep in mind. I think it's also important, if you check out the episode on sex, you'll find we talk about clitoris. And so if you're unable to have an orgasm or have painful orgasm, or it just doesn't feel right, maybe it leaves you feeling crampy. These are also issues of pelvic floor dysfunction. And we should, it would be great to address that in order to help your pelvic floor function. And then again, help the fertility journey. So those are some reasons why you would want to seek pelvic expert PT. And other common issues that could be stemming from your pelvic floor or indicate that you would need pelvic floor, that your pelvic floor is just like not as happy, would be low back pain. So pain in the low back can be coming from the pelvic floor. If you have achy or tight hips, that can absolutely be coming from the pelvic floor. Knee pain, even though that sounds funny, a lot of times if you are having knee pain, your core is probably not functioning, or you're shifting your weight one way or another, and so therefore your pelvic floor is not symmetric, and that can affect. And so your pelvic floor can have an effect even if you have knee pain. Stiff necks, difficulty with sex, painful sex, we talked about that, inability to have an orgasm, constipation and bloating, and then leaking pee. So that's kind of the recap there. A healthy pelvic floor is going to be able to do a couple moves. And so a healthy pelvic floor is going to be able to contract. It's also going to be able to relax and then bear down and open. And now most of us live in this contracted state. And so that's why Kegels aren't applicable, and Kegels aren't great or ideal for this state of living. And so therefore during pregnancy and during the fertility journey, doing a bunch of Kegels isn't going to help make things dynamic and fluid and how we want it to happen. And so just stop doing your Kegels and meet with a pelvic expert PT so you can really find out how your pelvic floor should function. Because especially as you move into pregnancy, your pelvic floor is just going to grip that much tighter in order to try and hold your pelvis together as your hormones become more lax, and that relaxin and progesterone affect the ligaments, and that helps with the pelvic opening. But what happens is the skeletal muscle of your pelvic floor wants to contract to hold it all together. Well, in order to birth baby, we need it to relax and to open. And check out the birthing episode all about this and preparing your pelvic floor, because we want to be all about the opening. Because the reality is every single woman that we see in our clinic is mostly at this like contracted state. And we're always having to undo that contracted state. So we hardly ever, ever, ever give Kegels. And it's all about that opening and relaxing, teaching the muscles to go to new positions, and then teaching the muscles to move within those positions. So that is really crucial. And it's crucial in the fertility process. Just some anecdotal stuff. So that is coordination, the muscle's ability to move through that contraction, through the relaxation, and then through the bulging. So the reason, let me just back up. I want to just tell you like a little bit of storytelling, and the reason I decided that we need to start talking about this stuff, and we need to know that that pelvic floor therapy can really help the fertility process, because so many people are suffering with infertility or just not having a good baseline going into their pregnancy, so that preconception period. And I just can't say it enough. So what we started to see, or especially in my early days of practicing, is I would be helping women postpartum heal their bodies. And this might even be a client who had IVF or had a C-section or really struggled to get pregnant that first time. And what we ended up seeing is that even in their postpartum journey, we would have people like accidentally getting pregnant, and they would get pregnant really quickly. Even, maybe they were just on the mini pill or not using like the greatest protection, but definitely not trying to get pregnant. And so we started to really see a connection with the, our postpartum women conceiving, even when they didn't want to be, and like the actual work of treating the pelvic floor. And I just can't state enough clinically. I believe fully that it's because we're opening up the pelvic floor, we are improving the blood flow, and therefore really truly help and decreasing adhesions and scar tissue, and then therefore truly helping that fertility process. So I think it has a much bigger impact than we will ever be able to measure in the research. And so anyone who is struggling with that fertility or going through infertility treatments and they're not successful, you need to give pelvic floor therapy a shot. You can come for an intensive at Body Motion here in Edmonds. We're in beautiful downtown Edmonds. I should have the Puget Sound in my background, but it's at the other window. And people come for intensives to our clinic. And so what that means is they'll fly from Alaska or fly from North Carolina, and they'll come for a week of 3 to 4 hours a day of treatment just to break up adhesions, teach the muscles how to move, and go that route. And we've just seen incredible results. And so which means lots of babies. And so we hope that this is helpful for you and you are learning something new about your body, and that you will tell every friend you have about this, if they're dealing with infertility or really want to prep their body for that pregnancy experience, or maybe potentially shorten their time of having to conceive, the amount of time. That they should give pelvic floor therapy a shot, because it can be truly a very holistic, non-invasive, no medicine involved, quick treatment, really. And so I hope you'll reach out if you have questions, and take care, guys.